Alright, good morning everybody. Today we're going to be going over EMS systems. This is going to be an introductory class, is like a basic EMT introduction course. So the goal of this class is going to be how to identify and understand the way EMS systems operate and what an EMS system actually is. So for starters, what is an EMS system? An EMS system is a coordinated network of people, vehicles, and institutions providing emergency medical care. A goal would be rapid, high-quality medical response and patient transport. So with that, we have our dispatch systems, then our initial response, going along with every other agency or entity that would be responding to a certain type of disaster or emergency. The components of the EMS system go as follows: 911 or emergency access point, emergency medical dispatch, first responders, which would be our EMTs, paramedics, fire, police. Then we have hospitals and specialty centers, medical direction, public health, and prevention efforts. So the levels of EMS providers varies. You have your EMRs, which are your very, very basic first responders. Most of the time you'll see police or entry-level firefighters have their EMR. Basically, they are immediate life-saving care until EMS arrives. They can do enough to attempt to stabilize the patient until we are able to get there to them. From that step, you'll have EMTs. So basic emergency care, transport, airway, and bleeding control. And advanced EMT, you, on top of the EMT skill, you add IV access and certain medications. And then from the AEMT, you have a paramedic, which takes all three levels of skill and adds into advanced airway, cardiac, and pharmacological interventions. They are able to do everything every other level can do. So if you want to look at it this way, an EMR is you've got CPR and other basic interventions that can fall under the Good Samaritan Act, and then your EMT takes all of your EMR skills and adds a few more into it. Your AEMT takes your EMT and EMR skills and adds a few more to it, and then your paramedic takes all three of those other levels and adds into those. So medical direction, there are two different kinds. You have offline and online, or direct and indirect. Offline medical direction would be your protocols, standing orders, basically like your written protocols that your agency follows. They all derive from the national standard and your state protocols. Your online or direct medical direction comes from real-time orders from your attending physician at your hospital or your medical director, either phone call or radio connection. Most of the time it's going to be a phone call. In the field, that's normally what we use here. Is we have everybody that works for us gets a phone number that they know that they can call, and if that phone number does not work or you're unable to get a hold of anybody, you were to call the receiving hospital and ask the physician or doctor in charge of that shift for orders, which could go anywhere from giving more medication than what you are limited to give. Nitro, if they're not prescribed nitro, you can call for medical orders to give nitro. And any time that you have any kind of concern or question about an intervention that you're wanting to do, it's always safe to contact medical control just to kind of get a another provider's preference or opinion on it. And then at the same time, what that does is if you're getting standing order, or if you're getting online medical direction from a attending physician, you're taking the responsibility of the intervention that you're wanting to do off of you, as per you could get in trouble for certain things. It takes the responsibility from giving that order off of you to that attending physician. So they would be responsible for telling you whether or not you can do a certain intervention that you're thinking might work, or if you're just lost and confused on what to do, it wouldn't hurt to go ahead and give them a call and try and see if there's anything they would recommend for you to do. So the EMT's role is to assess the patient and provide basic life-saving care. Communication with dispatch and hospitals, so giving a report to the incoming hospital as far as preparing them for the patient that you're bringing them. Safe transport and documentation. So safe transport is acting with due regard while you're driving, with or without lights and sirens. And then your patient documentation is going to go into your PCRs or your patient care report. Whether or not you document everything right is solely on you and nobody else. If you didn't document it, it didn't happen. I'm going to preach that to all of my classes. It's not just going to be something you hear once and you never hear again. If you did not document it, it did not happen. Document everything as it happens. And if you're not able to document it as it happens, jot down a note. You've always got gloves on. Personally, I like to take a piece of tape and I'll put it on my knee. So whenever I'm sitting down on the bench, reassessing a patient or monitoring vitals, I can write down pertinent information that might be useful in a PCR or to a nurse. You also have cooperation with other responders, fire, police, and the hospital. We're all one big team. We all want the same thing at the end of the day. We all have the same goal. There's no reason why we can't all work together. And it makes your job so much easier whenever you're able to coordinate with these other responders that are coming onto scenes where it requires everybody to work together. So system coordination and teamwork. Effective EMS relies on communication and coordination. Respect roles of each team member and follow the chain of command and your protocols. So effective EMS relies on communication and coordination. You and your partner, if you work with the same partner every shift, you're going to build a type of bond to where you're going to know what each other are doing. So for instance, me and my partner, if we get our patient in the back of the truck and my partner immediately goes and sits down beside the patient right beside the IV well, I know that he's going to want a 3-lead, and I know he's going to want SpO2 and tidal monitoring. So I will go ahead and have that set up and ready by the time he gets his line and he starts determining whether he's going to run normal saline or push any kind of medications. And you know, if he goes to the airway chair and sits behind the patient and starts messing around with the monitor, I know that it's going to be my patient, so I'm going to sit down beside the patient and I'm going to start getting demographics, past medical history, anything that I can use to kind of determine where we need to go with this patient or interventions that I'm going to be able to do. It's also going to help whenever you get to the hospital. The hospital staff are always going to ask for name, birthday, and what's going on. Past medical history, pertinent medical history, things like that. It's always good to know things like that rolling into the hospital. Your patient is always your number one priority. You and your partner are going to build that relationship based on how many calls you go on together, how closely you watch each other and notice patterns in things that each other do. Teamwork is always going to make the patient feel so much better whenever they see that you're working together in the back of the truck instead of against each other. So respecting roles of each team member. This kind of comes in handy with knowing your limitations. So if you're working with a paramedic partner, you have to respect that you're not always going to get to help. Your job may simply, on a critical patient, be getting them started on the monitor, baseline set of vitals, and then immediately getting in the driver's seat and riding to the hospital as quickly and safely as you can. Or, sometimes you're gonna have to call and coordinate with air medical while your partner is performing other interventions that you're not able to do. And then other times your partner is also gonna rely on you to look at everything from a BLS standpoint, because there's always the saying that basics save their medics and medics save the patient. So your partner, depending on how long they've been an ALS provider, if you're with an ALS provider, they're gonna look at everything from an ALS standpoint. Your basic life-saving skills, BLS before ALS, always. So there's gonna be some things that you're gonna notice that your partner may not even notice or think of. Certain simple interventions that might help that are more closer to your skills than there are to their skills. So it's always nice to be able to respect each other's roles. Without respect of each other's roles, the teamwork and camaraderie in the back of the truck is not gonna mix. And then following the chain of command and protocols, you always wanna follow your protocols, that way you're not risking any kind of harm to the patient or putting yourself in a position to where you can be scrutinized for harming a patient. As long as you follow your protocols and you do everything by the book as much as you can, you shouldn't have an issue at all. So with that being said, the final slide that I have for everybody is a review and discussion. So we're gonna go over what are the major components of the EMS system. So we've got 911, first responders, EMS, fire, and then the hospital. So also, how does medical direction influence field care? So with medical direction, you can always call whenever you're out of ideas or you're stuck. You don't know what to do. You don't think you know what to do. You can always call and ask for advice. Medical direction is always there for you. And if you can't get a hold of anybody, or if you don't want to call anybody, you always have protocols. Memorize your protocols. Always memorize your protocols. You're gonna need them eventually, and most of the time when you don't know them is when you need them. So what's the EMT's most important responsibility during an emergency? That is going to come down to what type of emergency it is and what kind of truck you're on. If you're on a BLS truck, you're going to want to load and go and get that patient to a higher level of care as soon as possible. And if you're unable to, you're going to need to call for ALS intercept. The EMT's role is to coordinate and make sure that everything is going right for this patient that it needs to be happening. So with that being said, this has been a basic EMT short lesson over the EMS systems and how it works. For my actual EMT class that I'm planning on helping put on early in the year, it's going to be a more in-depth lesson. It's going to be about 4 hours long. So this is kind of just the simplest breakdown that I can make of what I had already planned for my class. And with that being said, this is going to conclude my capstone slideshow lesson. Thank you guys. Have a great day.